with it.
Miche mag jodak ma Mumias e kaunti ma Kakamega oyudo kony mar thieth manono mochan gi riwruok mar Lichenga Foundation. Jodak eko oyudo chenro mag thieth mopogore opogore kama oting'o pim mar tuo mar kansa, malaria kod tuoche mamoko. Kolose boma ma Mumias, jatend riwruogno Dr. Brian Lichenga owacho ni Jo-Kenya mang'eny medo yudo midhiero mag yudo thieth kokalo e chenro mag okumba mag SHA, kendo kwayo sirikal mondo med bero chenro mag SHA.
We have a lot of people who have medical ailments that are not able to access healthcare for various reasons. There is still a very high proportion of out-of-pocket payments when they go to hospitals, and that is why we are seeing some of these conditions when they are fairly advanced. As far as registration with the Social Health Authority is concerned, our observation is we still have quite a number of Kenyans, residents of this area, who are yet to be registered. And we have some who have registered but are not up to date. When we have been asking, they have been telling us it is the cost. The cost of being compliant is a bit too high.
And most of the patients that we have been assessing here, we have found most of them have high blood pressure, high sugars, and also the general common conditions like malaria, flus, and even tuberculosis in general. But we are impressed this day because of most of the patients that have been assessed and most of the conditions that have been the patients have been found with, they have been given the required medication that they are supposed to be given.
All types of sickness. Kweli watu nimewaona wametibiwa, wameridhika. Mimi binafsi nimepata hata miwani hizi hapa for free. Sijalipa hata shilingi. Na ni wengi wamepata, wamenufaika.